Hey everybody, welcome back to the Teach Back method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to be discussing all the steps of a neurologic physical therapy exam. Let's break it down. There are 8 sections of the neurologic PT exam. We're going to break it down section by section, but overall, the first one is history, observation, and review of systems. The second is mental status. The third is cranial nerve integrity, sensory exam, motor exam, coordination exam, balance exam, and lastly, we need to do a functional exam and movement analysis. Now we're going to break everything down. The first section of our exam will include history, observation, and review of systems. So when we're doing this very first step, we're also going to do our chart review, and when we're looking in the chart review, we're going to look for medications, precautions, vitals, things like that. This is very important because we want to know what we're walking into. The next section in our exam is assessing the mental status of the patient. This is very important, including alert and orientation. Is the patient awake? Can they wake up? Do they know who they are, where they are, and why they're there? These are very important things we need to assess before we can continue on with our exam. If we do see anything that's concerning, we can do further mental function tests. An example of this could be the MOCA assessment. The third thing we want to assess is cranial nerve integrity. Cranial nerves 1 through 12 each have their own individual exam that can let us know if those nerves are intact or not. Moving on, our fourth section is the sensory exam. We're looking at quite a few things here, including a light touch, commonly done with a cotton ball. We can also assess pain, so we can do this with a clothespin, using the sharp end and the dull end to see if they are able to differentiate between these two. We can also assess temperature, as well as joint position will fall in this category. A common test that we use for spinal cord patients is known as the ASIA assessment. The fifth section in our neurological exam includes assessing motor function. There's a lot of different things we can do in this category, including range of motion, manual muscle testing, assessing for tone. We can be looking for things such as atrophy, rigidity, or spasticity in this section. The sixth section of our exam is coordination. So when we're assessing coordination, we're looking at a bunch of different things, such as our speed, accuracy, dual tasking, things like that. We're really looking for ataxia, and ataxia is just an umbrella term. So within ataxia, we're looking for tremors, dysmetria, dysdiadochokinesia, etc. The next thing we want to assess is a patient's balance. Balance can be assessed in multiple different positions. We can assess balance in sitting, standing, as well as walking balance. There are many different tests and outcome measures we can use to assess balance, such as the FIST, or function in sitting, the Berg balance, or even things like the mini best test. The last thing we want to assess is function as well as movement analysis. This is a big umbrella term, and we can pretty much assess anything, such as walking, stairs, or transfers. There are quite a few outcome measures we can use in this section, such as our 6-minute walk test, 10-meter walk test, etc. As you can see, there are many steps in a neurological PT exam, and unfortunately, we never have enough time to actually do all these things in one evaluation. Many times, we might only have 30 minutes to do an evaluation. Thus, we have to prioritize certain sections and screen other sections. So this is all determined based on a patient's individual diagnosis. I hope this all makes sense. Come back to my page for more videos.